here at our practice is the Thomasville Eye Center. We also work with the Moultrie Eye Center, and together we're called the Georgia Florida Eye Centers.
And how long have you been practicing?
Almost 25 years.
And can you give me an idea of what vision and perception issues face senior citizens?
Well, most commonly, everybody gets cataracts. Now, the idea that many elderly folks think that cataract is some kind of growth you get in your eye or a film that develops in your eye. But all a cataract actually is that everybody is born with a lens in their eye, just like a camera has a lens. And the lens of a person's eye gets cloudy as part of aging. And that's actually what a cataract is. Now, just because a person has a cataract is not a reason to have cataract surgery. It's only when the cataract gets to the stage that it starts interfering with the person's lifestyle or what they like to do day in and day out. Then it becomes a problem and needs to be addressed.
Is cataract surgery, is that an outpatient surgery?
Yes, we do it here in our surgery center. It's an outpatient procedure. We don't put people to sleep. We either use drops to anesthetize the eye, or most commonly we actually have an anesthesia doctor who will give some medication around the eye to put the eye to sleep for surgery.
Is glaucoma a real problem for senior citizens?
Yes, it is. Glaucoma is very prominent, especially in the African American population. It goes along with cataracts in a lot of cases, but patients can have glaucoma without having cataracts. Usually glaucoma, we see that in families of patients, just because a patient has a brother or sister or a mom or dad who had glaucoma doesn't mean you're going to have glaucoma. It makes you a little bit more likely to have glaucoma, but not necessarily that you will have it. But the difference between a cataract and glaucoma is that when the pressure in the eye gets too high and damages the eye, it can lead to permanent blindness. Now, cataracts can never cause permanent blindness. It can really diminish a person's vision, but really will never cause someone to become totally blind.
Can dementia affect or impact somebody's vision?
Of course. Dementia really doesn't affect the eye itself. It affects the brain and the brain centers that can control vision. I see patients frequently who are brought in by their family saying, mom or dad can't see the food in front of them, and something must be wrong with their eyes. Well, in a lot of those cases, they really don't have a problem with their eyes. It's the connections between the eye and the brain just aren't there anymore with Alzheimer's, and patients just actually, it's more of a brain issue than an eye issue. And even though they really can see that there's food in front of them or where they're going, the brain just doesn't tell the brain just doesn't tell the eye, and the eye doesn't connect with the brain the way it should.
How can we support senior citizens with visual difficulties?
Well, the big thing here is we have a lot of patients who just need to have their eyes examined. They may feel like they're having a problem and sit at home thinking, gosh, I don't know if I should go to the doctor or not. If there's any doubt, they should be. We can check for cataracts, we can check for glaucoma. Those are treatable conditions. A lot of patients have developed, as they get older, will develop macular degeneration, and that's a big scare among a lot of elderly patients. In fact, my father had macular degeneration before he passed away, and it's a condition that's just a deterioration of a part of the retina called the macula, and it's a lot of patients think that that's going to lead to total blindness, and it can be severely visually handicapping in a way, and the fact that it in its worst case scenario robs you of your central vision. Patients that have macular degeneration will always have their peripheral vision. That won't allow them to drive or do a lot of activities, but they can still see to get around relatively well in that type of situation.